Hi, I'm Dr. Robert Lowe. In these uncertain times after COVID-19 and opening our dental practices now carefully to avoid further spread as the disease starts to flatten out, I think we're starting a new time in dentistry. I've been around for 37 years, and I remember when AIDS was first happening, and disinfection and sterilization and many things on the way dental care was delivered was changed forever. Using mask and gloves and personal protection equipment became mandatory. The days when I trained in dental school in the late 70s and early 80s, those things didn't exist. Now today, in the presence of this latest pandemic with COVID-19, getting back to practice is been a challenge for all of us, particularly when we listen to news outlets and different recommendations on what we need to do. Questions come up on things like personal protection equipment, the effect of dental aerosols, and social distancing and spreading out appointments and things like that. We just opened our practice again a week ago last Monday, June 1st, and we did a lot of preparation for that day as far as informing our patients what protocols would be different. We are telling them that they cannot have somebody come to their appointment with them. If they do, they need to leave a phone number where we can text them and pick them up, have them pick up the patient at the end of their visit. We're not a big office, so the social distancing part has not been a problem. Normally in my office, it's me and my dental assistant and the patient, and maybe somebody in the waiting room, maybe. So that part has not been difficult, but we do all our pre-screening over the telephone and record those answers, and also have them fill out a pre-screening COVID-19 questionnaire when they come in, get their temperature taken. If they come in with a mask, we ask that they change it so they don't bring in anything potentially from the outside, and use hand washing and disinfection on their hands in the form of whatever you have available as far as Purell hand sanitizer. We are now in the hand sanitizing business, so we have that readily available for use for us and for the patients at any point in time. The patients brought back by the dental assistant, we now have a lot of plastic barriers. We take more time between patients to properly disinfect with our, coming over here, our Cavicide wipes, which I'm sure this has been mostly standard in dental practices from before COVID-19. Now we let that sit on the surfaces for 5 to 10 minutes and then clean them off and put plastic barriers on as well.